take a decision for C-section. So meanwhile, once your contractions are increasing, you can opt for an epidural where the anesthetist is involved and anesthesia doctor can explain you the process of epidural. It is given in your backbone through a fine needle, and this takes care of the labor pains. But what you have to understand is epidural is advised only after a certain stage of labor. Like once you've got into 3 centimeters and above, it would be much help to you. If you take a little early epidural, it might not help you. So many of them have a lot of misconceptions of epidural, that it can cause back pain and all. Those are not true. Epidural is for the comfort of the women to take up the pain for few hours, where she is getting a relaxed feeling, and the even what I would say that conserved energy is there for the end result, where she has to really push the baby. So that way epidural helps in a lot of patients. So this is the labor room scenario. And then once you have not done that, you are not progressing for a normal delivery, a C-section has to be decided. In that scenario, a C-section, once the decision is taken, there will be a consent given to you, explained to you by a consultant, that by your consultant, that what is the reason for C-section, and a detailed consent form is given where you have to sign, and then your signature will be taken in the records, where anesthesia doctor also explains you, and then you will be put in the bladder catheter, means the passage where the urine comes. There is a tube put, which is very much mandatory because you will not be able to get up and pass urine. So that is one thing, and we'll be given administrating you certain IV medicines which are called as antibiotics. So antibiotic is given, and then your intravenous and antiemetics and antacids, we call them, we give that also prior to the admission, prior to the admission to the cesarean section room, that is OT. And then once you're entering the OT, we prepare you after the anesthetist has given you the spinal anesthesia. Majority of the sections are done under spinal anesthesia. So after the spinal anesthesia, you are prepared, and then your companion husband is allowed in the operation theater. Okay. So in any scenario, the pediatrician is present at the delivery room, and then your delayed cord clamping has to be done. So that is followed in all the cases. And if you have taken for a stem cell banking, so stem cell banking, whenever you have taken, as soon as you come to the hospital, you have to tell the concerned sister and tell the concerned consultant that you have booked for a stem cells. Because few cases, what happens that if it is not informed, it goes unnoticed, and after the everything has happened, that time you come back and tell, no, I have taken the stem cells. Stem cells have to be taken immediately after the delivery of the baby, before the placenta separates. So this understanding has to be there, because once the placenta comes out, we cannot take the stem cells. So this has to be told. And once the baby is delivered, the baby is assessed, and baby is taken to the warmer. Pediatrician will assess in all the parameters. We call it as a Apgar score. And the baby is examined thoroughly, and then the baby is handed over to the mother for a breastfeeding. That is called as golden hour feeding. That is done by the sister in the delivery room only, and even in a C-section in the OT. So within 1 hour, we feed the baby, and all babies are kept under the warmer for the next till the mother recovers. So that observation period after a normal delivery without any complications, a period of 2 hours is mandatory for observing the mother and the baby. And once she is voided, she's fine, she's able to take something to eat, then she'll be shifted to the wards. After a C-section also, we'll be taking her, monitoring her blood pressure, her bleeding, her pain factor, and then after that, she'll be taking the final.
10 minutes. Please don't go. Please don't go.
So then after the
I'm sorry.
okay. Sorry. So after the 2 hours of period where it has been seen that mother and the baby are fine, then she'll be shifted to the wards. So in the wards, yeah, for allowing for the oral liquids at least we take around few doctors follow after 4 hours, few doctors follow after 6 hours for starting the oral liquids, and then your soft type depending on how you're progressing. So after a normal delivery, yes, you need not follow any of the restrictions of movements after a normal delivery. You can walk through, you can sit down, feed the babies, and all those things can be told. Even after C-section, you will be able to move your legs after 6 hours. Your anesthesia remains for 6 hours. So after 6 hours, you can move your legs, all that. Though the catheter is, the urine bag is kept for long because there can be a sudden giddiness when you get up. So for those factors, we keep it for a little while. And once a patient is comfortable, we remove the catheter. So in the hospital, so you'll be provided with a diet which is designed by the dietitian. So you have to make sure that you're breastfeeding the baby, learn the breastfeeding, that is more important, because every 2 hours, if you learn the baby breastfeeding, after you go home, you'll not have any challenges in adjusting to the baby. So all the sutures what we have putting now, all are self-dissolvable sutures. Whether it's a normal delivery or a C-section, the sutures are self-dissolvable. So there is nothing undissolvable that you need to come for suture removal. It's just a dressing where the superficial dressing, which is called as waterproof, which is put on the day of discharge. You can continue to take bath even after you go home, and a week later you can come to remove that dressing. So these are the things. And when you're in the hospital, there'll be few things like physiotherapist, a dietitian advice will be given. A physiotherapist will come and talk to you. What are the movements and what are the exercises you can do it. So these are can be taught. And baby pediatrician will do all the blood tests which are required for the baby, even the jaundice, even the we call it as metabolic disorders screening test. So that is called as Guthrie test. That is also done, and a hearing test is also done, and all the vaccination is put to the baby and send you home with a chart of vaccination and when do you come back for a visit. Generally, for a pediatrician, they will call you in a span of fifth or sixth day following the delivery. So these are the situations. So when you come to the hospital, I think all these things you have been given at your counseling session, that you have to carry what are the things is hospital file, your ID, insurance papers. So many of the patients ask me what and all. See, basically you have to carry the most important things are hospital file. Rest of the things can be managed after your delivery also. So those are the things what you should not forget. And the baby, of course, the baby clothes, the blankets, extra set of things should be kept. Anything like it can be socks, it can be mittens, it can be clothes. So all these things should be kept. So this is what I had explained you. Now, I mean, the what is the step-by-step triage, doctor checkup, admission, tests, all that. So at the time of admission, what I had told you. So basically, what you have to understand is whatever the scenario is, so the having a you know less you should not be stressed about these things, like what will happen. So if I reach the hospital late and if this is not checked, if that happens, see, we do understand the situations, but yes, having a calm environment is always better. So going stepwise is always better. So as a doctor, I tell all my patients that even if you take, it's like they ask me, doctor, if I take 2 hours to reach the hospital, if I take 1 hour, what will happen? Said, see, if you have crossed 34 weeks of pregnancy, you're in the late third trimester, and any of these situations arises, so don't panic. After 34 weeks, the baby and the mother are not into a risk scenarios. So before that, if things are happening, yes, we need to come a little earlier to the hospital, because we have to make sure that your preterm delivery can be halted, and then we can keep the baby inside as long as we want. So those are the scenarios which has to be addressed. And but percentage of preterm deliveries happening before 34 weeks is not like day to day many patients have the preterm delivery. It is not so. So having a less stress in pregnancy works in a longer way. And when the day of your delivery also, so it is in a long run, it will help you to be better. So we can pick up the queries later.
Okay. I'll take you all through nursing part of care. So as the mother, she comes from labor room, that is from after a normal delivery. So we nurses receive mother to the ward. So I'm going to talk to you all in the ward, what happens. As a mother being received from the LDR, that is labor room, to the ward. So then we assess mother with the vital signs. So we check the heart rate and the blood pressure and the oxygen level, how much she's maintained, and then the BP of the mother. So then we also assist mother in the feeding. So feeding, initially we help them out by giving the position. Okay, so for mother, because as she has delivered and she's come, she might be not in the position to take the baby and feed the baby on her own. So we help her stay with her, and then we help her by assisting in the feeding. And then after that, we also give her the food will be served for the mother. So once after the food has been served, her medications part. So all on timely medications are being given to the mother as advised by the doctor. So the medicine, since is a normal delivery, if when mother has had a normal delivery, we will start as soon as she's been brought from the labor room to the ward, we give her food is served, and then she'll start taking a medicine by mouth. And then the next day, so she will start carrying out her routine work. That way she will be able to walk, use a washroom, and then she can come back. So that all assistant, we will be with her mother, taking her to the washroom and then bringing her back to the bed, and helping her to lie on the bed. And the next day, we will also give mother massage, that is a body massage, and also for the baby, bath will be given. And then way she'll also feel very comfortable after the body massage is provided for her, and baby also will feel very comfortable after the bath. So in the case of C-section, Since the mother after C-section happened, she'll be moved from the recovery room, from the operation theater. She'll be assessed and monitored in the recovery room. So that is next to the operation theater only. There's a room called recovery room where she has to get recovered from the anesthesia. So during that period, she'll be continuously monitored with all the vital signs, that is her temperature and respiration, blood pressure, and also her heart rate. So when all of this are monitored, and then when she is stable enough to move from recovery room to the ward, with doctor's approval, we will shift the mother from the recovery room to the ward. So once when mother comes to the ward, we will also give her a position where she is comfortably laid on the bed, and then she will be on catheter. Okay, so she may not be in the position to get out of the bed and use the washroom. So since the catheter is in place, so we will take care of that by emptying the urine bag. And also she'll be on the IV fluids because she might be not immediately allowed to take anything by mouth. So then for that, IV fluids will be ordered, advised, and then that part also will be taking care of it. So once the 6 hours is over, so we will start with a clear liquids. So we will, as per doctor's advice, we will start with the clear liquids, and then slowly we will also start with a soft diet. So on the same time, then the next day of her C-section, we will give her the demo. That is, we will start giving her body massage, and then bath she will have, and then also for the baby, same body massage will be given for the baby, slight massage, and then we'll start with the bath. So then same time, once if it is everything goes well, then cannula, she will be on IV fluids. The IV fluids is stopped and the cannulas are removed on day 2. So once when the day 2 is over, we will take out the cannula out, and then our lactation consultant is there, lactation counselor, who comes and visits the mother. She will also explain to the mother that what all the positions will be the best positions that way the mother can carry out. And also she will take some classes during when mother is admitted in the hospital. And if any challenges mother is facing, she can always consult and take her opinion. And then again for her, for the baby, we will also do the urine testing, and the vaccination will be done when the baby is in the hospital. And also during the hospital, we also advise, we encourage mothers to give kangaroo mother care, which is very essential for the baby's growth and development. This kangaroo mother care is nothing, it's how we have to give it to baby is that mother have to expose her chest, bare chest, and then same baby also will be exposed the chest. So both bodies, that is both chest, come in contact, and good 15 to 20 minutes where baby's chest, bare chest is placed over mother's bare chest. So that has a lot of benefits, helping in the lactation part, as well as it helps in the growth and development of baby by gaining weight. And also baby will feel very comfort that baby is not left alone, the bondages increase. So there's a lot of benefits. Researchers have shown that by doing this kangaroo mother care, baby's weight gain is improved a lot, and also baby mother's lactation part is improved. This can be done by father also. So once, if after going home, it is not only to be done in the hospital, we train and we teach you how to do it. So this can be carried out once after you going back home. This can be the same way it can be done with father too. Okay. And also we provide home care services. So the whatever the massage and bath, what we give it in the hospital when you stay during the hospital. So the same thing, if you expect that our team, that is a nursing team, have to come home and do the same thing at home, we also provide. There are different hours, timings are there. It preferable for you, how you wanted to choose, like for 3 hours, 4 hours, and for 8 hours, even for night stay also we have care. So that part you can discuss after delivery, with a nurse manager over there in the place that way you will deliver. Thank you. So queries, maybe later we can take it off. The next part will hand over to Deep.
Thank you so much, Mashiba, for taking care of that part explanation. Now we welcome Ms. Deepa. So she will be taking up the from admission till relief, all the process. She'll be explaining us here.
Hi, good afternoon, I'm Deepa here. I'll be taking you through admission and discharge process. So once you enter the hospital, so admission process will be taking care. So we'll be guiding or we'll be accompanying the customer or patient along with the GREs to the room. So once they're settled in the room, then financial counseling part will be taking care, and we'll be explaining all the details of the finance, like packages and all. Already CREs would have explained the packages. So we'll also go through once the package according to whether it is cash package or the insurance, according to which insurance they have. Okay. So all billing process, everything will be explained there only. And room orientation also will be given over there. Once again. Next slide.
I think the slides were not changing.
Yeah, it is not changing.
Okay, we can like click there. Maybe it will change on every click. It's fine. We can start resharing.
Yeah.
Yes.
Thank you. Okay, so after the admission process, like doctor advice, the all the other things will be taking care, and nursing part, everything will be there, and simultaneously the housekeeping services also will be there. So 3 times a day housekeeping services will be there. Before you enter the room, everything will be set by the housekeeping team, like washroom setup will be there, bed setup, every setup will be done by the housekeeping team. So required things, everything will be kept. If in case you require it again, you can, on request, we'll be providing it again. And food service, according to doctor's advice, the food will be served in the room, like whether it is liquid diet or whatsoever, so it will be provided. And if it is a signature package, the facility will be bit higher, like fruits will be kept in the room, and few biscuits or and candlelight dinner will be provided on the day of discharge or a day prior to the discharge, and cake cutting will be there. So along with all this facility, we'll be taking a group pic of the parents, just to celebrate the happiness of a new born. And on the day of discharge, photo shoot will be there. Okay, complimentary photograph will be provided to customer. So there is a different team for this. So they'll be taking the pic, and you can choose whichever photos you want. And this is basically if the baby is preterm or any requirement for the NICU and neonatal intensive care unit. So baby will be kept in the NICU. After the treatment, the baby will be shifted to the ward. So basically, long stay babies in the NICU will be celebrating with the cake cutting, and then the discharge will be happening. Okay, on the day of discharge, this is a token of happiness. We'll be providing a plant and few gift hampers. And on the day of discharge, before you leave, car decoration will be done. And on the day of baby birth, room will be decorated with the means room door will be decorated with balloons. Okay, so discharge process, basically once doctor advises for the discharge, so after a doctor's rounds, usually doctor's round will be done in the morning, and after that they'll be advising for the discharge by examining the patient as well as mother and baby. Or obstetrician will be advising for mother, and pediatrician will be advising for baby. Okay, so once both is cleared, so the clearance process will start. So the clearance process will start from nursing side, then it will go to pharmacy, then housekeeping, pantry, OT, LDR, everywhere the clearance we get, and later it comes again to the nursing team, and later it will be provided to the billing team. So once we get the clearance process, we start the billing process. So once the billing process is done according to the patients, this one, like whether it is cash or insurance. So if it is cash, the billing will be prepared, and we'll be giving it to the patient. So once they check, then will be the payment will be done, and the bill will be closed, and discharge will be completed. So if it is insurance, it will be the billing will be prepared, handed over to the patient. Once they check, we'll be processing it to the particular insurance. Once everything is done, we'll be receiving the final approval. So validation will be done. Once the validation is done, the payment collection will be done, and the bill closure will be taking place. And later the discharge process will complete over there, and we'll be handovering all the documents like bill, discharge summary, baby book. All the baby book will be containing all the details of baby, like baby birth time, and baby mother blood group, all those things will be mentioned in it. And whatever vaccination has been given, it will be mentioned in the baby book. So all this will be handed over to the patient along with the report, lab reports. Thank you. If any doubts.
Thank you so much to all our speakers here. And now I would request Dr. Sushmita also to come up on screen, and let's take as many queries as we can from the participants. I'll read out the queries based on the query. You can answer them, and let me spotlight. Okay, now I think Miss Sheba and Miss Deepa can be on one screen, and we already have Dr. Sushmita here on our screen. Okay, so I'll start from question first. The first question, what is the file that doctor is referring to? Is there a file that is being maintained, or all the prescriptions till date we have to carry?
So the registration day, when a file is provided with the number and all, so all your scans and the blood test will be attached in that file. That is the file what I was mentioning about.
Okay.
Okay.
Basically, it is called OPD file, which they'll be carrying every day for the consultation.
Yeah.
Okay. Next question, how much fasting is required before C-section? After how many hours of C-section patient can have the food?
Okay, so minimum requirement is 6 hours, 6 hours of fasting before a C-section. So in an emergency, we don't see this strict hours of 6 hours. In emergency, you have to go in for a C-section. But if it's an elective procedures, we minimum require is 6 hours of fasting without even liquids. And after a C-section, if it is a very uncomplicated case, so few consultants leave to start your sips of water and clear liquids in 4 hours, but few consultants follow of 6 hours. So anything between 4 and 6 hours, you can start your liquids and then slowly move on to the soft diet once you're all right.
Next question. Hello, doctor. I have placenta previa condition. Will I have water break scenario or abdominal pain before labor?
See, placenta previa is a condition where the placenta is low-lying. So you can have a scenario of water breakage as well, but more common is you can have a bleeding. Bleeding would be more common than a water breakage in your case.
Um, enema will give in both normal and C-section.
See, enema, in C-section, we don't follow giving an enema. But for your labor process, if it is being that you've not moved your bowels, so enema can be given to make your ease of process of delivery. So it's like your bowel is empty, so you'll feel much better in the process of second stage, that is pushing stage. You'll feel much comfortable with enema. So if you have moved your bowels and then you have come to a hospital where in the recent few hours you have moved your bowels, then no need of enema. You can be avoiding it. It all depends on scenario to scenario. But C-sections generally, majority of the consultants follow no enema. So there are few consultants still follow enema before a surgery also. So it depends on your consultant.
Next question. Okay, is this protocol of C-section carried the same way in all the Cloud9 branches?
Majority of it. Because decision of a C-section taken and then preparing the consent form and giving you injections and antibiotic and antacids and then examined by anesthetist and then shifting to the OT theater. In any hospital, the scenario is the same.
Next question. How baby will feed after C-section?
So generally, we have a nurse who will be assisting the pediatrician. That nurse, after dressing up the baby, and the baby is, the approval she gets from the pediatrician, the baby is brought on the table to the table where the mother is lying down, and she gives the feed holding the baby. So that is called as golden hour feeding, actually. So even in the OT theater, we do follow the golden hour feeding.
Ms. Shiba, if you can elaborate a little on this, something that you want to add.
We follow the football position. That is nothing but holding the head. And as doctors explained, the same way only. When mother is lying, we put babies, holding her head and putting directly onto mother's breast. So then baby will able to suck and take the milk.
Okay. Will there be someone to help us initiate the cashless insurance process? I have already taken the package. Is it possible to upgrade it now?
Yeah, definitely. There is a team for insurance who will be helping through documents and all. What is required, they'll be informing you. If any queries from insurance also, they are there to answer it. So yes, after taking the packages also, you can upgrade contacting your CREs.
And by when should we book the room if it's insurance?
If it is insurance or not, also same process only. So I think 4th month or 5th month they take the booking, if I'm not wrong.
Okay. Do we get baby birth certificate in the hospital? Is there any process to get it?
Yes, actually here we on the day of admission itself we'll be providing a form, that is BBMP form, for the parent to fill it. So we'll be taking it back before the discharge. So there is timeline which will be submitting it to the BBMP, and we will be receiving the certificate in the hospital and few centers. I think they have to go directly to the BBMP and collect it. So here we collect it, and a parent can come and collect it from the hospital.
Okay. What all facilities are there in the platinum package? So I think this will be a little elaborated one. But we can just give a gist, because the customer relation executives will be the best person to explain all the services to you, and you can connect with any of the CRE at the center which you are consulting, and you'll get the details. But yeah, for sure, Ms. Deepa can tell a little about it.
Platinum in the sense talking about
maybe this is the bed booking package, or I think.
Okay, luxury.
Okay, I'm not sure. So I think we can connect with the CRE at the
CRE
center,
is better.
and then you will get a better detailed details about it. So next question: how much operation time will it take for C-section for twin baby?
See, the difference between delivering a twins and a single baby would be another extra 10 minutes maximum, depends on the position of the second baby.
Okay.
Yes.
Next question. Any maternity item will be provided by the hospital, or do we need to bring things we needed like maternity pads?
Uh, any maternity items will be provided by the hospital, or yeah, it will be provided.
Okay. What all? Okay, so I think we need a collective answer on this. What all things we need to carry in our hospital bag?
Like already, I think doctor explained few things.
Yes, yes.
1
See,
second, let me go through it.
Yeah, the slide is there, what you take on a hospital bag. So basically, the hospital bag contains the file to the hospital, all the documents, the insurance cards and Aadhaar card, ID cards and all. And the maternal, the mother per se go home dress, the maternal feeding bras, you can take it. And you can also carry your panties and sanitary pads and any of the other things like your moisturizers and those aspects. And for the babies per se, you can carry the baby extra blankets and extra mittens, socks, and then caps and extra dresses for the baby. And photo shoot, anyways, one is done in the hospital. So you can carry a nice dresses for the baby and the mother for photo shoot. That is
And initially, once the baby is born, dress will be provided here, but on charge basis. So later, to change, you can bring it by yourself.
Thank you. One question is, my 8th month started and the baby is in cephalic position, I think. Presentation it is written. In first growth, will baby position change again?
Yeah, of course. The baby, we can expect the baby position to change till almost 36 weeks. So majority of the babies are in cephalic position, but if you have a good amount of water around the baby, the position can change.
Okay. Next question, if Mishiba can answer this. Baby is first given to the mother or the family members after delivery?
It is given to mother first.
Okay, okay. Is husband allowed inside the operation theater?
Yes, yes. Husband is allowed, not for the entire process actually. It is only after the baby is born. That is the time where husband is advised to come inside the OT. And once the husband talks to the pediatrician, sees the baby, and he'll be allowed to talk to the mother also. And once he's, seen both of them, then we allow the father to go and do the admission process.
Okay. Next question, but in C-section, we will not immediately get milk production to feed. Will any medication be given to get the milk production during golden hour?
See, for all post-deliveries, there won't be the proper milk which comes. It's the initial secretions, which is, we call it as a colostrum. So these are the drops of colostrum which is getting produced. And as the baby is sucking, it do come. So the first 2 days, it's only the colostrum. It's the drops of colostrum which is fed to the baby.
Next question is, I'm at my end of 31st week. From last 2-3 days, I have been feeling that when I stand for a little longer, or at times while sitting, there's a sudden pressure feeling of heaviness towards my pelvis. Do I need to get myself checked, or is it normal?
So you're in the 31st week. If your last scan, I think definitely one growth scan would have done for you by now. So if the cervical length is good, and this pulling pain can be because of your ligament pull, and the baby settles down to the low position, that is a head down position. When the baby movements are there, you can feel a little pressure sensation, and even the bladder frequency might increase. So if you have this constant discomfort and also associated with white discharge or so, and there is a concern with the urine passing disturbances, like it can be a discomfort, frequency, or pain, or burning while passing urine, better to go and meet your concerned doctor. So at least we can rule out the other factors like urine infection or whether these are signs of early labor. These can be ruled out.
Next question is, hospital will take care of the insurance claim process, or we only need to provide basic insurance details?
Yeah, as I told prior, we have a team for it. So we'll be collecting a few documents from your side and few forms to be filled by you and signature required. Later, the insurance team will be taking care of the process.
Okay. Next question, we have taken signature package. Will room be allotted or any booking to be done?
So basically, whatever package it is, room booking is required.
Next question, is there menstrual bleeding after C-section?
Yes, you can expect 3 weeks of menstrual bleeding, even if you deliver normally or C-section. So you can expect for 3 weeks.
Okay. Will the husband be given skin to skin during golden hour?
No, as
Not allowed.
not allowed. So after maybe the third day or
Okay.
fourth day, after when baby is maintain temperature and baby is fine, all well, so they can slowly start with
Okay.
with husband.
Okay. So is the father not allowed in the labor room during the entire procedure for normal delivery?
He's allowed. He's allowed. Only one attendant who is allowed is husband in the LDR. So throughout the process of monitoring of the labor and the delivery and post delivery also till she is shifted to the wards, husband is allowed.
Next, also the umbilical cord kept till the blood is completely transferred and the placenta is allowed to come out naturally.
Yes, yes. So this is called as delayed cord clamping. We follow it for all patients for delayed cord clamping. So once the 1 minute is over, when the pediatrician says we can clamp, and then the umbilical cord is clamped, and then the baby is handed over to the pediatrician.
Next, do we have tie-ups for stem cell banking? How much does it cost?
Yeah, we do have tie-ups, but the costing will depend upon the branches. So better person will be the CREs who will explain about it. And there is a team for this umbilical cord. So they are the right person to explain about the cost.
I think we have this collaboration with CryoViva.
Yes.
So
we have a
Cryo
team.
9, now it is called as
Cryo 9.
Cryo 9.
Cryo 9. So
Yeah.
they'll be explaining about the cost to the customer.
Okay. All the MBA participants, here I would request all of you to please log into the portal, like sign into the portal. Check there is a section of stem cell banking, and there are recorded videos of stem cell banking as well. So you will get the details in that session. And yeah, very soon if the next stem cell banking session happens, then also we can tell you. So now question is, I'm having difficulty in sleeping on my left side because of back pain and upper left abdomen pain. Is it okay to sleep on my right for longer time?
Yes, yes. See, it is not 100% the rule that you have to sleep only on the left side. There can be a situation that you will not be comfortable on the left side. So right side is also okay. So it is not going to cause any bigger problem to your baby. So don't worry about it. I would suggest that don't maintain a similar position. You keep changing the positions. So there is no stiffness of the muscles and the pain experience is much better when you keep changing the position. So don't stick on to a single position to sleep.
Okay.
So that is an advice what I would suggest.
Few importance of or benefits of stem cell banking, if you can explain, doctor.
See, stem cells, majority of the stem cells in India now are under research only. So there are few blood things which have been taken care, like thalassemia and a few of the anemias. We call it as a genetically herited anemias. And then there are into the development of treating the diabetes now. And then the arthritis, very early onset arthritis is also being, uh, I mean, they're just into the research. So down the lane, after few years later, stem cells would be the advanced technique for treating majority of the diseases which are going to be long term. Okay, so still there are no clear-cut evidences that, yeah, this disease, this has to be used. So there is a lot of research going on, and this stem cells, once you preserve it, it will be like, if depending on what you have taken, like 50 years or 30 years or lifelong, so it will be kept. It is kept into the pool where they culture the cells, and this pool you can access it for any of your family member. So what they do is they collect your sample, and they take an agreement also when you are getting into the agreement of stem cells. So they tell that you are going it for a universal stem cells banking or your particular stem cell banking. So once you're that is called as community pool, if I'm not wrong. So you will be given the access where even if the other stem cells are matching to your requirement, you can segregate the usage. So if you don't give a consent, then I think that particular time they go into the process of agreement. I'm not sure because it depends from company to company. So this is the general process what they do.
I think stem cell banking. Please watch that session. That is really informative. Like we do have people or managers from Cryo 9 joining us in that session. They have explained the package, the benefits, and also have given few coupon codes which you can apply and get some discount. So everything is there in and the contact details are also there. So please do check the recorded session as well. Next question: how to do room booking for delivery?
Room booking, basically there will be a customer care executive who's explaining the package and in touch with the customer, so they can contact them or they can contact the hospital reception, so they'll help for the bed booking.
Next question. Placenta will be allowed to come naturally.
Yeah, definitely. Placenta is allowed to come naturally.
Next question is photo allowed when we first see the baby in labor room?
See, basically, the phones and things should be restricted in the OT because it also adds on to the sterility. And yeah, that is a legal process where I think they have to take a permission that I'll take my mobile inside. So that depends on center to center, probably.
Okay. Is father allowed to cut umbilical cord?
See, C-section, it is, I mean, it is not practical. For a normal delivery, probably we can allow him for a cord cutting.
Okay. So hi doctor, I'm in my 33 week. Sometimes I'm having slight pain in my vagina. What can be the cause? According to last ultrasound report, everything is fine.
So your discomfort in the vagina can be because of the growing size of the uterus, and so the round ligament, we call it as a ligament, which gets attached to the your vaginal wall. That could have been the constant pulling. That's the reason the pain and the discomfort is more common in the third trimester. So generally, this discomfort goes away with a rest. So you need not be worried about it. But if it is really bothering you, then there are few exercises which are taught by the physiotherapist, which you can take it, and which makes you a little relaxed with this stretching, pulling pain. So you can definitely contact the physiotherapist also.
Okay, so if we have already taken the package, when should we do the room booking? Okay.
I didn't get you.
If we have already taken the package, when should we do the room booking?
If they have already taken the package, CRS would have contacted for the room booking to them. Maybe prior to the admission also they can do the room booking.
One question is, we have We have paid an advance of 8K and ours is a insurance case that is cashless. Do we also have to pre-book the room?
Which 8,000 they have paid is for the bed booking.
Okay, so they have to, they don't have to book it now
No,
because that
that will
payment
be the
is
bed
already.
booking. They
Okay,
can
okay.
check the receipt which they have. It will be mentioned as bed booking.
Okay, okay. So that means the bed booking is done. Yes. Next question. Okay, so this question I have to answer. Where can we find the session for stem cell? So you log into MBA portal. You can go through website. You can go through app. You can just type Masters in Baby Affair cloud Masters in Baby Affair dot learn. Sorry, dot learn or dot com. There it will ask you to sign in. You sign in using your mail ID which has been registered for this course and the password which the CRE might have already set for when they registered you. In case you have forgotten it, you click on forgot and then you will get the recovery password on your registered mail ID. Sign in there, go to MBA program. It will be divided into trimester 1, trimester 2 and trimester 3. I think it is in trimester 3. If you click there, you will find the recorded session. I'll show it here as well. I think we have taken a lot of queries. I'll share my screen and show it once here so that all our participants can see. Let me know if my screen is visible. Is my screen visible?
Yes. Yes.
So here, yes. So here we will go. All our participants can see this. We will go to www.masters in, or you can just type Master in Baby Affairs. Okay, this is it. Masters in Baby Affair. Okay, this is my thing. View as learner. So if you go as a participant, as a learner or as a user, you will see many courses. You have to go to Masters in Baby Affair. Purchased, it will show for all of you. Click here. Check, go to trimester 1, trimester 2, trimester 3. Most probably in trimester 3. Trimester 3, if you'll see on right hand side, stem cell. Let me see. I think it was there. These are all the sessions you will get recorded once. Let me see in trimester 2. Let me see pregnancy, physical, stem cell banking. You go to stem cell banking, click on video, and you will get the whole session on stem cell banking. Okay, this is the whole session. So this will tell you about cord blood banking, and you will get all the clinical, they will tell you how the process goes, what are the prices. So you can watch this complete session. The prices are also mentioned. See, exclusive offers and all that are already mentioned. How much price, 21 years at 75 years. So like that. So this is the recorded video, which you can watch. I hope this will be useful for our participants. Okay, so with that, we will wrap up the session now. We have taken almost all the question. In case any of your question has remained unanswered because of the shortage of time, we have already crossed the 1 hour mark. So I think we can wrap up the session now. Thank you, participants. But I request all of you to please vote for the session right after the session ends here. Please go and vote for the session on the poll that will run right after this on the WhatsApp groups. Thank you so much for joining. And I would love to see few of your feedback down in the chat box so that we can understand how useful the session was, how informative was it for all of you. And I thank all our speakers here, Ms. Shiba, Ms. Deepa and Dr. Sushmita who have joined here for the session. Thank you so much for giving us some time here. And participants, thank you so much for your patience. And let's sign off now. Take care, everyone. Thank you so much.
Thank you.
Please
Thank
do
you.
vote for the session right after we wrap up the session here.